Today is International Nurses Day, celebrated each year on May the 12th as it's Florence Nightingale's birthday. She's the woman who's widely regarded as one of the founders of modern nursing. Well, this year marks her bicentenary and falls during one of the world's biggest ever healthcare emergencies. The COVID-19 pandemic is a stark reminder of the critical role nurses play. Across Europe, ordinary citizens have come out onto the streets to applaud the frontline heroes who've been battling to halt the pandemic. But many in the profession are calling for governments to recognise their contribution by improving pay and conditions. Well, for more on this, let's speak now to Floriana Pinto. She's an intensive care nurse working in Milan's largest hospital, Ospedale Nigada. Well, thanks for taking time to speak to us here. Of course, the role of nurses is very much at the forefront during this COVID-19 pandemic. Describe what it's been like for you.
For my, it was a real big challenge because the most difficult challenge was to act and to work in the continuum of being a human and also as professional. So we faced lots of challenge during this period, during these last 2 months, in the terms of structure, because we create new ICU in operating theaters, in terms of time, because we have to use the time in the way which is better for our patients. So in the terms of our heavy weight that we use. So the mask, it was difficult to talk to the patients. So the relational part was the most difficult because with the mask it's difficult to talk with them. So we start to use our eyes to smile with our eyes and talk to them. So the relational part was the most challenging. We built new structure for this pandemic, and we start to work with other colleagues who were not prepared to work in ICU and for the pandemic. So, it was really, really difficult in terms of new structures, in terms of time, and in terms of our protecting clothing. They were very heavy to wear.
You give us a good idea of how complicated it must have been, but do you feel that Italy was adequately prepared for what happened?
So nobody could have been prepared to this emergency. For an emergency, you have to train and to plan to react, and we haven't any time to prepare to react to this. So we have to use the time in the most right way. So we try to do our best, and I think it's one of the most important things of nurses show in this emergency, because we show that when we want, we are a really powerful team. So I think that this pandemic showed to nurses themselves what kind of professional we are, and what kind of professional that we can be, and that we can be to influence the policy. So this is a particular day today. We celebrate the bicentenary of Florence Nightingale birth. And in this particular day, I want, and all my colleagues, everybody should celebrate not heroes, but professionals. And I would like to say thank you to all my colleagues from all over the world for their work at any level of our profession. And I would also like to thank you in particular, who has lost his life, saving life during this pandemic. And, we are continuing now to work. Numbers are slowing down during this period, this fact is allowing us to thinking more to the relational part. But healthcare professionals are still working in the pandemic. We are more of 24,000 infections among healthcare professionals, and
Floriana
100
Pinto.
have lost his life.
I'm afraid I have to interrupt you there because that's all we have time for, but thank you for expressing yourself here on the programme and giving your time to us here.